a health system approach, and this is actually a health system approach to public health research. Remember, I mentioned this earlier, and if you have no idea of what that is about, well, you're going to find out right about now, because I do actually have with me Dr. Michael Clarke, who is the Adjunct Professor, the Interfaculty Program in Public Health, and also Professor Terence Seemungal. So they are in studio with me to tell us all about what this health system approach to public health research is all about. So good morning to you, gentlemen. So glad to have you on Good Morning Trinidad and Tobago.
Good morning. Thank you for having us.
Now, you are a guest, as I understand. You're a distinguished, the University of the West Indies first, though. They're hosting the Open Lectures Committee. They're hosting the Distinguished Open Lecture with Dr. Michael Clarke, who is the Adjunct Professor in the Interfaculty Program in Public Health at the, and I need help to pronounce this one, the School of Medicine.
Shula. Yes.
Shula School of Medicine and Dentistry at Western University in London, Ontario. And Dr. Clarke is going to be speaking on the healthcare system approach to public health research and how critical underpinning of implementing a health in all policies or a health impact assessment policies that addresses the upstream issues that define a sustainable, healthy nation and equity in healthcare. But I think our guests will be better able to explain what this is all about this morning. Who wants to be?
Yes, okay, well, I'll have a go. All right, so I'm here in my capacity as Dean of the Faculty of Medical Sciences. And what we want to do is to focus the research in the faculty towards public health care and to produce outcomes that are useful to the nation as a whole. The faculty has in the past been quite active in research, but we like to pull all the strands together and focus on public health. Professor Clarke is very experienced with this. He has worked in his capacity as director of the International Development Research Center in Canada, has worked with several developing nations throughout Africa, Latin America, but he's not come to the English-speaking Caribbean as yet, so we feel quite lucky to have caught him. And his focus is on public health, and I think I'll let him take over from here.
Yeah, so public health, Dr. Clarke, and I think especially now in the carnival season, you know, we need to focus more on public health. So many of us are going to be out there buying foods, doing different things as well, and we really need to take care of our health when we're doing these things. We need to be careful. So what's the focus going to be on with this lecture that's coming up?
Well, the whole focus, on public health is really a preventative approach. It turns out that about 50% of all the underlying contributors to ill health, to bad health, are preventable. Things that we can do to avoid becoming ill. So 50% is a large part of our well-being or our lack of well-being. So, but we could do something about that. So these are issues, for example, the way that our cities are built in such a way that we don't walk enough. We need the car. So the car is an issue. The way our buildings are built, the fact that everybody uses the elevator and not the stairs. The fact that there is a very serious issue, not just in Trinidad and Tobago, but actually globally with obesity.
Yes.
And overweight as a consequence of malnutrition, actually. Malnutrition means you're eating badly. And that's a problem here. The data is available, and that's something that people can do something about.
Well, I know the schools, the Ministry of Education has said that they're going to stop sugars and various things in the schools. What do you think about that venture, and what else can be done as well to assist and help children? And you know, when you talk about malnutrition, people think, you know, it's because you're not eating, so you're losing weight, but there's also malnutrition when you overeat and you eat the wrong types of foods.
Exactly.
And so people have that misconception when they hear the word malnutrition as well. But what else does not just the Ministry of Education, but parents too, in trying to raise, because we do have the issue of obesity.
Yes.
We have the results, as you mentioned.
Yeah.
What else can be done? Stopping sugary foods in school, you know, monitoring the diet in schools, but what else needs to be done, especially with our children?
Well, parents are one influence in a child's life, and then there are all the other influences, as you're well aware of. And they're subjected to messages coming from their peers, so other children, but also messages that I see on billboards and advertising across the city, including promoting not very healthy foods. So I think the children are being influenced by many things. Certainly parents can do their very best to encourage the children not to consume unhealthy foods, not to consume too much sugar or fat or starch. But the messages are out there, and they're pervasive, and you see them just driving down the road. You see the big advertisements for very unhealthy food there. And food becomes embedded in people's lives. Obviously, changing food culture is very, very difficult. But there is good food here. There's no question about it. I've enjoyed it while I've been here. Thank you very much.
You're welcome.
I do think there's an opportunity to change policy. So parents can do something, but I also think government is very much in control of policy around how food is marketed, how it's produced, and how it's sold to consumers.
You know something, you're talking about very good food here. You know, some people, doubles, things like doubles and roti and those types of things are staple in our diet. Would you consider, and you know, we're now hearing, okay, the chana might be good, the chickpeas might be good, but then the bara, the roti, well, the bread part, the flour part of it, they say is not. So how would you consider and how would you label, in a sense, types of foods like that? And we're talking healthy and not healthy. Would you say yes or no?
I think labeling or understanding what the ingredients are in the food is a huge step forward. And there's a lot of research out there to show that people will actually pay attention to what's in their food, particularly if it's translated into calories. And if people understand the relationship between calorie consumption and their current weight status, they will do something about it. There's no question about that. People are smart. But it's sometimes not very apparent, you know, that there's this relationship between calorie intake and your weight.
I recently read, and I believe it's true, in France that they're having these urine stations now to try to keep France a little bit cleaner because, and we have a problem here with that as well. You see men jump out their vehicles, more men than women, to do their little thing wherever. Now France has these urine stations and apparently they're recycling that. So you have these stations, you go, and it's pretty, it's decorated. And then they recycle it. What do you think about that? And do you think that, well, I don't know how much you know about Trinidad and Tobago, but do you think that it can, even, you know, Professor Seemungal, maybe you can answer this as well, can be implemented something like that in Trinidad and Tobago?
Okay, well, I haven't seen that sort of thing. I really don't. I would hear what Clarke has to say.
Okay, Dr.
Well, I certainly have seen them, and they're prominent, even as you're walking down some of the main streets in Paris, for example. I think that's a good step. I mean, people have to go, and when you have to go, you go. And so having those public facilities available is a good thing. But in itself, I don't think that has a huge impact on health. Washing hands, all right, and personal sanitation, of course, is a huge step forward to try and block the transmission of certain diseases. So that, I think, is actually probably something that people can do something about very quickly, as opposed to waiting for public urination stations to be built. Right.
All right, so tell us a little bit more about when these open lectures are going to be taking place, Professor Seemungal.
Okay, well, sorry, the lecture was actually yesterday.
It was?
Yes.
Oh dear.
Yeah, but we have a series of meetings. For instance, this morning we're going to meet with the Minister of Health, and tomorrow there'll be a public health meeting involving other stakeholders, including the Food and Beverage Manufacturing Association, with the university. And then on Friday he will meet with us again within the faculty, and then he goes to Tobago for the weekend.
Brilliant.
So yes, so he'll have a chance to, and then meet the Tobago Regional Health Authority on Monday.
Okay, great. Have you sampled Tobago food yet?
Not yet.
Okay, because they're slightly different from us. You're going to love it.
Oh, well,
lots of blue food. Maybe you can, you know, check out the health in that too. That's why, you know, I find it Tobagonian.
Very good, very good.
Thank you both for being here with me this morning. Dr. Michael Clarke, the Adjunct Professor from the Interfaculty Program in Public Health, and I still don't remember, Schulich. School of Medicine and Dentistry, Western University in London, Ontario, and Professor Terence Seemungal, who is also the Dean of the Faculty of Medical Sciences. Thank you all very much.
Thank you.
And I hope this makes starts, to have Trinidad and Tobago on a healthier road, because we need to be. So thank you.
Thank you.